Hello, I'm Dr. Shlomit Schaal. I'm the Chief Physician Executive at Houston Methodist. And welcome to Women in Surgery, where we host some very accomplished surgeons. All of them just happen to be women. And today I have a pleasure of hosting an out-of-town surgeon, Dr. Sharona Ross. Welcome to Houston.
Oh, thank you.
Tell us who you are and what brought you here.
I'm a foregut and HPV surgeon who converted her entire practice to robotics, minimally invasive. And I just love what I do. I'm at Advent Health Tampa, and I really believe in supporting the new generation of women. And so that became my passion, other than embracing innovation into surgery to improve patients' outcomes. I do have a priority to promote the next generation and bring them to surgery, to choose surgery for especially the women among the pre-med medical students and residents and all of them, to try to help those that not sure as to what to choose and those that know where they want to be, but help them excel.
So you have a very interesting career path, right? And we'd like to kind of share, if you want to share with us, how did you get to where you are today?
Wow, I think believing in yourself and setting the goals is key. Setting the expectations is also. So I started all of this. I was married, and I was always wanted to have 4 kids and be a surgeon. And so when you have those goals, you just have to pursue them and set the expectations right, so the people you're with know what's going to happen. And if that happens, then everything is perfect. Although there's nothing really perfect, but as close to perfect as possible. And so, when I met the person who became my husband, I told him, and I told his mother, who was from the U.S., like, I don't cook, I don't clean, I don't do laundry, and I'm going to medical school. And I just finished my military service in Israel. And so that's when I came out, and I was told in the military, oh, you just find a nice man, get married, have kids, you'll forget about medical school. But I was like, no, this is what I'm doing. So as soon as I met him, and then his mom came they were from here and from the US, and then they came to Israel and asked me the same questions, like, so how are we going to do this? I said, listen, I don't cook, I don't clean, I don't do laundry, and I'm going to medical school. And she's looking at me, looking at him, and it's like, so what is he going to do? I said, well, I looked at her, I looked at him, and I was like, he's going to have to keep up. And she loved it. And she wanted to, at the end of our dinner and all that, she was asking, do I have a sister for her other son? But that's, when you set your life, you have to have goals, and you have to set the expectations around you, because you can't do anything truly alone, especially if you want a family.
So you decided very early on that you want to be a surgeon? And
yes.
Why?
So there was a show, Quincy. It was a forensic pathologist back in the day. I was 12. And I saw it, and I was like, oh my goodness. He was trying to figure out how people passed away. And so he was doing autopsies, and I loved that whole investigation. But I thought that autopsy is what all pathologists always do. And that's what I was. So I was 12, trying to look for a mentor but it took me about a year and a half to find a mentor in Kaplan Hospital, which there was no hospital in Ashdod, where I'm from in Israel. And so
now there is.
Now there is, and a good one. And I have fellows that I trained there.
Okay.
But it's like there was none. And so it took me a year and a half to find a mentor, a woman mentor that was a pathologist at a Kaplan Hospital, to guide me. And so she said yes. I was by then 13. And she said, I have no idea what we're going to do, but let's find out. And I went right after high school. Every day, took the bus, went to the hospital there, and we figured out what we're going to do. And we did a research project about Israeli Ashkenazi versus Sephardic with breast cancer, and the differences, survival, and all that. But that's when I realized that I'm not interested in pathology. Most of the time they look at slides. I was like, no. And I was also mature. And so I'm like, hey, I can help somebody who is alive, because I was afraid before, like, I don't want to hurt anybody, right? So they're already dead, and so I'm not going to help figuring out what they passed away from. But here, I can really help people by doing it. So level of maturity, and then what I knew I didn't want to do, and I decided I want to be a surgeon. And so it was very early in life, and then I had to join the military right after high school, which is mandatory, as you know.
Yes.
And then
What did you do in the military?
I was a paramedic. Started as a paramedic because I didn't want to go to the medical school through the military, because then I have to give 5 years of...
Like I did.
Exactly. I didn't want to...
He didn't want to.
Exactly.
Okay, good.
But I wanted
You're
to go to
smarter than I am.
surgery.
Okay, good.
Well, no, but I wanted to go to surgery, so I knew I needed to just do whatever I need to do, and I love medicine. So I ended up being a head base clinic, and had 2 ambulance drivers. I had physicians that came and gone, and then I had 5 nurses, and I loved it. And it was everybody there told me, all the physicians told me, don't go to medical school. You know, it's like, because it's HMO in Israel, and so you don't make any money, and it's like it's a long training, and what do you end up with? I mean, somebody that did a lot less and same salary, and so, but I loved my passion, and so that's when I met the first weekend I came out. I was discharged from the military. That's when I met my future husband, and that's what I told him. Look, I don't clean, I don't cook, I don't do laundry, and I'm going to medical school. So setting the expectation, and it was great.
So you went to medical school in the United States?
Yes. So, well, I did undergraduate in DC, and then medical school, and then I did residency in Florida, and then 2 fellowships.
So residency in
Surgery.
general surgery,
Correct.
which was long.
Well, 5 years, yeah.
Yes. And then 2 fellowship. What kind of fellowships?
So the first one was HPB, an advanced GI.
What is HPB?
It's a hepato-pancreatico-biliary. So it's taking care of diseases and disorders, malignancies of the pancreas, duodenum, biliary, and liver. And also, then I did, so it's an HPB and foregut. And so I did a lot of esophagectomies, gastrectomies, and things. So 80% of what I was trained was like cancer.
Yeah, and when was that? What year?
2006.
2006.
And then I did another fellowship, which was in endoscopy, because I really wanted, since I remember myself, is to try to minimize trauma to the patient. And so I worked with, I did a fellowship with gastroenterologists to learn how to do endoscopy and all that, because there was the talk then about notes, natural orifice transluminal endoscopic surgery. So doing an operation right through the natural orifices, so through the mouth, through the rectum. And so I did a lab, but just worked on that, like doing a pancreatectomy through transcolonic. Oh, gastrectomy, which is like going through the colon, going up into doing the gastrectomy, or doing cholecystectomy through the stomach. But everything through orifices.
Yeah.
And that's when I realized.
So every fellowship is how long?
1 year.
1 year.
1 year.
So 7 years of training, and during those 7 years, did you have your 4 kids that you wanted?
No, my first. So I wanted that when I'm done with my training, I'm done with diapers. So my first 2 kids were during undergraduate, and then so my first child was a surprise. I was on the pills, but it was the best thing that happened to me, because it was like, when do you plan to have the first child? I mean, it's never the perfect time. So I was a week late, and I was like, I'm on the pills, but I was pregnant, and I was like, it couldn't be more perfect. So we decided, okay, I was an undergraduate, great, and we made it happen. And again, as I set up the expectation with my in-laws and all, I mean, they were very supportive, because they knew I don't cook, I don't clean, I don't so they were very helpful. And so that was during undergraduate. During medical school, as soon as I knew what my next step is, then I had a month to get pregnant. I had 2 months that I wanted to breastfeed, because I believe in breastfeeding, but I didn't have the opportunity to really breastfeed for a long time. Remember, when I was doing all of this, if people knew you had kids or anything, you won't get to medical school because they think you're not going to finish. So I had to hide everything.
So you started medical school with one kid?
Two.
Two kids. Okay, you
I had a
started.
baby, so I had a year and 5 months, and I had 2 months.
Were you the only student with kids, or there are others?
I don't know.
Nobody told
talked
you.
about it. Nobody
Interesting.
talked about it. And my husband started law school.
Okay.
We're all and it worked out. But you need plan A, plan B, plan C, and you have to have support. My mom moved from Israel and was there to help us for a while. And so his family was helping very much so. But it's you set the expectation, you told them what you want to be. And so they're not like, oh my goodness, she's expecting to. No.
So hold on, did you ever feel guilty that you're not with your kids? Because I know I did. So how about you?
Oh my, yeah, that's why I'm writing a book now. But
Okay.
but because so just to finish the residency, I brought the third one, and then medical school the third one, residency the fourth one.
So goal achieved.
Correct. And then starting fellowship, I was like ready to go. But I had an accident recently on June 1st, 2025. And that I fractured my skull, my face, my clavicle. I paralyzed my right leg for about 5 days. I don't remember anything from the day of the accident to 3 weeks following. And when it came back, I was already in rehab in Atlanta, in the brain injury rehab, and which was amazing. But when I woke up in rehab, I was like, what are we doing? And my kids were around me. I have the four kids, which are all adults now. What are we doing here? And they were telling me, and I was like, where's my CT scan? I want to see the MRI. When was the last x-ray of the, I was like, whoa, what happened? So I had diffuse axonal injury. So when I hit my brain, the axons, they're not that disrupted. And so I would tell you how I had to do a Whipple, but I don't remember that we had the conversation until 3 weeks later. So why am I telling you that? Because that before I work. I was trained by, baby boomers, men. So that's how I did. And suddenly when within seconds you can lose your life, everything. I want my kids, I want grandkids, everything can be taken away. Because I thought nothing's going to happen to this. I took the risk and I did everything. I worked hard, but I got everything that I worked for. So I never expected anything bad to happen. So this was a wake-up call. And it came, and I will never say that in front of my kids because they were truly traumatized. But it's the best thing that happened to me at my stage of career. Because before, it was always about work. I was never on the schedule. I'm 56, never had a colonoscopy, never had a mammogram. My patients, 45. There's a new, the age for colonoscopy and mammograms and all.
So you didn't take care of yourself?
Nothing.
Because
I was never on the schedule. Because as long as I'm going, there's no reason to do that. But when you're faced with a life-threatening accident and everything can be taken away, and I was riding a bicycle, just didn't wear a helmet, and I love speed. I do like to go fast.
You did not wear a helmet?
No.
Oh no,
I wear a helmet on my motorcycle, but I have 55 years when it happened. It's like nothing happened, and I try to be careful. But anyway, I went too fast, and apparently I went down Bel Air Bridge in Florida, and I always go too fast, and I guess something was on the ground, and apparently I did this, not knowing, and I fell and didn't protect my head because I had to protect my hands as a surgeon.
Yeah.
I have no memory, but because of my injury, they knew that I did this.
Wow.
But yeah, and so now I'm all back, but that was a huge wake-up
So what
call.
did you change in your life as a result of that? This was like a year ago?
Well, it's almost 10 months, June 1st,
Yes.
in 2025. But so I decided to write a book. And the book is the first thing is I wanted to make sure, because I always did everything the same way. So if I don't write something to push me to follow this, I'm not going to change the way I do things. So the book is there first to make sure I am making a difference. So Mondays and Friday, I used to see 50, almost 40 to 50 patients on Monday, 40 to 50 patients on Friday in clinic. Then Tuesday, Wednesday, Thursday, I would operate. And I would operate until like 7 p.m. or so. I mean, like when you do Whipples and, you know, a lot of big total gastrectomies, esophagectomies, you know. So it takes a lot of time. And so it was all about work. And my kids, always remember, always said like, Mom, there's always going to be another patient. But if a patient comes to me with cancer, it's like, and those cancers that I treat, so I just worked what worked. So now I'm going to 20 to 25 patients in clinic on Mondays and Fridays. That's how I'm starting.
Okay.
And then trying to
And you're
have,
going to ride your bike with a helmet now?
I still can't because my kids won't let me still. I
Ah,
told you they were really traumatized.
so
So
you're
then
not
one
riding your
time
bike because...
before I'm running the risk, because I can't ride horses yet. I can't do the bikes and I can't go do the motorcycle.
Okay.
But hopefully soon, because that's how I want to retire in a ranch with
Okay, so how
horses.
did you get to this idea of promoting women in surgery?
So in 2009, we had a summer research program at USF at Tama General Hospital. That's the area where we did that every summer. And it was students like pre-med, medical students, people that I think they're going to be interested, and we'd show them what research is, shadowing it with us on what it is to be a surgeon and all that. And that, when 2009, the first year we had but 3 women. I was like, wow, I was so excited. Like, finally, I'm not alone. And so I asked them, so what made you want to become surgeons? And it's like, oh, no, we don't want to be surgeons. I was like, why not? And had such a negative perception about surgery. Oh, I want to have a life. I want to have a husband and have kids and have a normal life. And they were really, I mean, yes, it was male dominant, still male dominated profession, but it was getting better from that perspective, and there were a little bit more women, but they were very negative about the field. And so I was like, So I did an Evite at the time. There were no social media, wasn't that big before. And in 2009, I invited students from around the Tampa Bay area, and then brought like a few women that were attending surgeons, women, my residents, and a fellow of mine that was a woman, and brought them together. And I had like 100 students that RSVP'd and showed up to my home. And in the living room, I couldn't get them out after midnight. It was just magical.
What did you talk about?
Everything, all the questions that they had. And they were just so impressed with where we are as women in the field. And I was like talking to, and it was Covidian was the only company then that had a support for women in surgery. And so I had Linda Riccitelli with me from Covidian in that evening. And I looked at her and I was like, God, if there's such a need in the Tampa Bay area, there must be a need like this everywhere.
Mm-hmm.
So the 2010 was the first Women in Surgery, International Women in Surgery Career Symposium. I had women from 25 to 30 states.
Wow.
I had from Canada, from Japan, from Europe, from Mexico, from the Middle East. Just if
So the
from
women in surgery was all kinds of surgery or general surgery?
all kind of surgery. It's just women in surgery. And my co-chair was Julie Freshleg.
Wow.
So I called her one day. So that for the 2010,
That's a legend.
Yes. And she became my mentor. And she was the chair of Johns Hopkins. And I was like,
first surgical chair ever.
exactly. And she's so supportive. So I called her and we talked, and so she became my co-chair for multiple years. And now we're back. So, but my point is, we started this, and every year I thought, well, we'll do it for a few years, and then we want to hopefully develop the numbers of women and that will help each other. And we won't need this event because, it's not an association. And specifically, I didn't make it into an association because we have so many. It belongs to everyone.
Yep.
You know what I mean? It's one event once a year and where everybody comes together. And so, but it grew bigger and bigger and bigger. And every year now I have to close the registration at 700 because you don't want it to be too big because you want people to communicate.
So you had it every year since?
16th year, we just celebrated the 16th year.
Amazing.
I was like 2-3 year attending surgeon. So I was coming out of fellowship. And I thought like...
So how, in these 16 years, how has the field changed?
We started, when I started, it was like around 5% women. Now we're like near the 30s. So it's growing. But now I feel that it's like when women are coming and it's like a tribe, it's like a community. It's like in the beginning, by the way, when it's the first 5 years, all the women came and they were like, it was so hard for me. I don't have a husband. I don't have a family. I don't have kids. I had to do everything was to pave the way. It was so hard. Why should I make it easier for you guys?
Oh,
you know what I mean?
That's
that was the kind of the
interesting
beginning.
attitude. Okay.
Yeah, but it weren't badly. It's just like I had it hard. There's different challenges. You should, experience the same. But then it all changed. And then it would come every weekend and they come to help each other. And it's real. And remember, in the beginning, I paid for everything. Just the flights, the this, I raised all the money and just show up. Now, they don't get paid for anything. And even the flight, the faculty pays. You know what I mean? Because I try to use the money that we raise to support the students.
Uh-huh.
So I pay for the registration, for the hotel, for everything else. And every year I was able to bring about 300 to 400 students.
Wow, amazing.
Which
it's medical students.
It's pre-med and medical students. And now we have a program for STEM students. Because you need to, it's getting more competitive. So it's like you get them early on.
And is it only for women or?
Yeah, well, yeah.
So do you get any pushback because, these,
From who?
In general.
Remember, I don't have it's not an organization. I don't have a board.
Okay.
I decide where it's going to be.
Okay.
So who's going to tell me?
I think, in recent years, I think even for us here at Houston Methodist, when we try to promote specifically women and help women, which I think is really important because there's still inequities, we get some pushback just because of the national narrative of, you should help everybody. Why are you choosing according to gender?
That's a great question because there is equity, but what I did see, and I'm in many, many different societies, is you see a lot of men, and we're the women. And I'm talking about equity, like they all have merit. It's not like we're trying to bring somebody that is not deserving. No, but we're not seen. You know what I mean? And not every organization. There are great societies that are just incredible. But there's some that you see majority are men. And you look at the stage, it's like, we're the women. Because I know they're there. They're incredible women. But it's just, we don't thinking about it. But men, and I love it. My mentors were all men. So it's not like I'm saying something negative about the men. But it's our turn, women, to help each other. That's also in my book, because it's like, it's one thing to work hard to get there, but the new generation doesn't want what we did, which is it's all about work. They want quality of life, they want balance, they want all of that. We need to all come to the middle because the patient is still at the center. But this is not good. This is maybe can be coming a little bit to the middle. And so we need the younger generation, which nowadays more than 50% of the medical students are women, but not likely to choose surgery. We still are low. The numbers are getting better, but we still can get better.
How about department chairs? More women are department chairs of surgery?
The more, and that's why about women helping other women and women empowering and inspiring other women is as we get to a leadership position, it's time to send the elevator down. It's time for women to help other women. And I'm not talking, it's all about merit, but see them, help them, show them so for me, I had 4 kids, and you said about the guilt with kids, it was all about work. And so when the 80-hour work week started, I was in residency, and suddenly I went to go and pick up my 3rd daughter, which was in daycare, and they wouldn't give me my daughter because they never saw me. I was like,
They didn't know who you are.
they had no idea. And I was like, 8-hour work week. I felt like I could have a second job because I was every other night. I was like the old days. It's just like all work. I would leave at 4 a.m. in the morning. I would come back about 10 to midnight only to be on call the next day. That was my life. But here it's like 8-hour work week. Like I went to pick her up and it was like, who are you? So I had my neighbor telling them like, no, that's the mother. And I was like, all I did is walked away and cried. But
Interesting. So, today, at least here at Houston Methodist, we talk a lot about joy in medicine and the danger of burnout in the profession. And I'm, listening to your story, and I'm feeling your still passion and enthusiasm to the work that you're doing and other women or other surgeons in general are doing. How do you keep the joy, and how do you make sure that you prevent burnout? Because it's a very tough profession, taking care of the sickest people. There is a burden. How do you make sure that you yourself are taken care of?
Yeah, so I don't, but I didn't until the accident happened. But I focus on my patients, and so I have support groups. I have all those things that I do for patients, especially with cancer, and working with them is what makes me keep on going. It's that touch of seeing the impact you have on their lives and on their families, and you stay in touch. All my patients have my cell number, and nobody abuses it. And I tell them, text me if you need anything, and concerned about anything, you have a question. They all have my number. And I started that at COVID because, people were not were sick, and so nobody answers the phone. And so you got my number, and it worked very well. And so my patients are what drives me to continue. But like I told you, my kids, they're always going to be another patient. So what I'm planning to do is the balance now, which I'm trying to teach myself because
Maybe the younger generation can teach you.
Well, exactly. I'm trying to listen. Before I would be in a Whipple, and the younger generation, the medical students, that ask me, "Hey, can I go to lunch?" It's like, I was afraid to ask to go to the bathroom, and then asking to go to lunch in the middle of a case. We're still in the case. And I was like, and then at 6 o'clock, can I go to yoga? I have a yoga. We didn't round. And I'm not saying that to them, but I'm thinking that. I was like, it's like, but after the accident, I understand it. It needs to change.
Mm-hmm.
You know what I mean? I never was on my schedule. You got to put yourself on the schedule because I thought, I'll find it on, and you never do. So you got to be on the whatever is important to you has got to be on the schedule. Your kids, your events, because if not on your schedule, it's not going to happen. During COVID, suddenly when I have like a Whipple and then the patient has COVID, so the case is canceled, I'm like, I have the day off. And I was like, then I started to have more and more days off when the patients came and couldn't do it. I was like, wow, this is nice. And so then I started to book for the first time vacations ahead of time, put it on your schedule 6 months later, and it works. You know what I mean? So there's a way to do it. I'm just figuring out how to do it. And I think once our generation would figure this out, more are going to come and join in the field, which we need because otherwise we'll have shortage.
Dr. Ross, what are you doing here in Houston?
Pat contacted me and he said, Dr. Reardon, and he said, look, we have minimally invasive symposium here. Would you come to talk? And I was like, anything you ask, I would say yes, because he is incredible. What a supportive surgeon he is of women. For the Women in Surgery Symposium that we talked about before, he sends medical students every year. He sends women to that. I mean, one of the very few that support like no other. So he called me and he said, hey, we have this symposium and it's about minimally invasive surgery and new technology and how do you apply it to patients. And of course I said yes. And I love innovation and being here in Houston. And this is downtown. It's all healthcare. I mean, it's I've never seen anything like this.
It's the Texas Medical Center. It's the biggest medical center in the world.
Unbelievable.
Yeah.
And you have labs here. We did, I worked with the surgeons here showing how to do robotic Whipples. And it's just, you got everything here. I mean, everything is walking distance. It's unbelievable. So the quality, of the equipment here, the personnel, I mean, literally, you got everything here. Everything. So you bring in all this knowledge from all around to really support the residents, the fellows, the attending surgeon of what's new and what should you look into.
Yeah.
And does it work, doesn't it? I mean, it's incredible. I wish more people, more surgeons around the country will do that to their institutions. I mean, it's incredible.
So, Dr. Ross, it's very obvious to me that you're very innovative, you're very passionate. There's an app that you developed. Tell us about that app.
Yes. So I was on an airplane going to one of those conferences, and I saw there was something about Bumble or something about dating, and the CEO of that company was there talking about how she developed it, and the importance of community, and putting the women there, like what they need, and all. So women. And I was like, how the Women in Surgery Symposium is happening once a year. And then what? So all the students, the pre-med medical students, residents, they have this one weekend to find all the mentors, all the sponsors and all, and then the whole rest of the year is gone. Wouldn't that be nice if I develop a community for all those women to come together if they need to shadow somebody in specific hospital, specific university, specific state, shadowing, research, going to go to the residency or fellowship, or looking for a job, looking for anything. You can communicate, find mentors, sponsors, and it's all a community of women that would help each other. But it's not only, it starts from STEM students, medical students, pre-med medical students, residents, fellows, attending surgeons, ARNPs, PAs, everybody in the surgical, and women in innovation.
So what's the name of the app? How can I download
it's Women in Surgery.
Women in Surgery, okay.
Yes, and I'm going to change it to Women in Surgery and Innovation, because I want the women in industry to come together with the women in surgery, because we're all together to help each other. And
Fantastic.
if we start to help each other, nobody can stop us.
Fantastic. Dr. Ross, thank you so much for your time this morning.
Pleasure is all mine.
And thank you for watching. This was another episode of Women in Surgery. Watch us again next time.